First is the bad news. You may know that New Hampshire is now 6th in the country for fatal drug overdoses per capita, and we remain second to last in the country for providing accessible treatment, only behind Texas. This public health crisis has killed almost 1 million people nationally over the last decade. In New Hampshire, there are more than 18,000 grandparents and other caregivers raising children who are not their own. In 2012, New Hampshire had 43 overdoses, and by 2020, there were over 400. And then to compound this issue, there's a severe workforce shortage of trained professionals to serve the number of people needing services. The Center for Disease Control says that investing $1 in addiction services can help save $7 to $15 in related costs down the road, including incarceration, foster care placements, ER visits, medical care for babies born addicted, lost workplace productivity, and accidental deaths. In the Monadnock Region, we have very few resources for treatment and recovery, and there's only 2 certified prevention specialists in the region. I'm one of them, and the other one works here with me at Reality Check. My name is Mary Drew, and I founded Reality Check in 2008 after I began my own recovery from alcoholism. It is a 501c3 nonprofit located at 17 Turnpike Road in Jaffrey, and our mission is to prevent and reduce substance use, addiction, and overdose, and the related social and economic costs to individuals, families, and businesses by providing comprehensive addiction services. We provide drug and alcohol prevention curriculum to schools, programming, training, events, to entire districts and communities throughout the region. We also provide supported referrals to treatment and recovery supports to anyone seeking recovery. Last, we offer employer services showing businesses how to be recovery friendly toward employees with substance use issues by offering recovery coaching, on-site interventions, policy modification support, and direct referrals to treatment. In 2016, we were awarded a 5-year drug-free community grant from the White House Office of National Drug Control Policy to offer prevention initiatives in this region. And last month, we were awarded our second 5-year DFC grant to continue building on this work. Our aim is to engage more partners to become invested in prevention for a more collective impact. And we're expanding this focus to include raising more awareness around mental health issues, specifically how to recognize signs of depression and suicidal ideation, and then what to do about it. Unfortunately, a state grant through the Bureau of Drug and Alcohol Services, which funds 17 recovery centers across the state, including us, is still in limbo with state leadership, which last year took 5 months to approve. Without it, we had to cancel our on-call recovery coach program, our Recovery Coach Academy training series, and our free drug and alcohol counseling. But the importance of recovery supports in the community cannot be emphasized enough to help prevent relapse post-treatment. Recovery coaches meet people where they are to help start rebuilding their lives, and they help people access other needed services. In 2020, over 20 people utilized a coach and attended more than 152 support groups. We also engaged over 40 businesses to become recovery friendly, including the state of New Hampshire, representing over 18,000 employees statewide. We provided 28 different addiction trainings and trained 176 people, many of whom went on to seek their certification with the state as a certified recovery coach. So if chosen, we'll use the funds to pay recovery coach stipends and to offer 1 recovery coach training series, which can be upwards of $8,000. So with your help, we can reduce the stigma surrounding mental health and addiction and shift the culture within our own homes, in our workplaces, in our schools, in our communities, to be more supportive of people who struggle with these issues. Because as long as there's hope, as long as people are alive, there's hope. Thank you so much for allowing me to speak.